President of Electro-Homeopathy Research Foundation, India, Dr. Giridhar Gopal, retired Colonel Dr. Hemalata, Dr. Veena, and the research doctors who are presenting the research results in this forum, and all the participants of this scientific seminar on electro-homeopathy. At the outset, once again, I extend a very warm welcome for this interesting seminar on electro-homeopathy research in India. When I attended the first convention in the Bangalore, as in Gandhi Bhavan, to celebrate Dr. Matty's birthday, I was very much impressed with their scientific explanation for the disease and the cure at the root cause of the problem with plant extracts. After processing, you just take the disease will be cured at the root. That was the one which motivated me to get into this seminar. I now requested Dr. Huda and Dr. Giridhar Gopal to organize all the researchers, especially with MBBS and PhD qualification background, to present the research papers in this online forum. This online forum is attended by most of the people who are interested in promoting this type of research in India. So based on our suggestion, Dr. Veena has taken the initiative to organize all the doctors to be present in their main findings in a simple format, understandable to the common man. So this seminar, I request all the speakers, so restrict to 5 or 6 this presentation of materials in such a way, in 5 minutes, you should convey what exactly is the advantage of taking electro-homeopathy. With this, again, the short opening remarks, I request Giridhar Gopal to introduce the first speaker, mainly our Dr. Huda, on legality of electro-homeopathy and start the seminar. So we'll be given the timing in the beginning itself. I will monitor the timing so that we finish this by exactly 1 o'clock, 12 o'clock. 1 o'clock.
We will finish it by 12:30. Okay. So we have 30 minutes for review by the specialists on the board. Wonderful. And question answers, if any. Wonderful. Before I go into the session, I would like to request Dr. Vijaykanth Agnihotri to say a few words. Okay. Dr. Agnihotri?
Yeah, good morning to everybody. It's a very nice starting of this type of seminars where every homeopathic practitioner will be given a chance to share his experience regarding whatever findings they have. And this sharing will definitely give us lead regarding drugs which are very efficient, and manufacturer companies, and the method that they had followed, plant material from where they had got, because drugs are there and they are effective. But only the thing is that in my observation came that some companies drugs are very efficient and some are less efficient. So this sharing of knowledge on patients will definitely give us very good leads. So best of luck for this seminar. Yes, sir. By these words, I am ending.
Thank you very much, Dr. Agnihotri. Do we have Mrs. Mohanty online with us already? Mrs. Mohanty?
Yes, sir.
Yeah, Pooja Mohanty, I would like you to say a few words. Pooja Mohanty is from ICMR Jalma, which is known to try out various things I think, you know, JALMA has also tried electro-homeopathy, the efficacy of it on leprosy patients. Am I right?
Yes, sir.
Right. Pooja, I'd like a few words from you.
Yes, sir. Yes, sir. Good morning, sir.
Very good.
Good day. Very good day to you all. Sir, my name is Dr. Pooja Mohanty. I'm microbiologist, and in the JALMA Institute under the ICMR. Here, earlier my husband was the scientist. He expired in the last wave COVID. So after that, I'm starting to beginning the researches in different diseases. So like you are saying, leprosy and TB. So it is the main concern of the nowadays research going on here also. And my objective is to to introduce the people about electro-homeopathy. We can help the patients and their long back means disease orders which are going on in the normal practices like medicines. So everybody is dependent only on the medicines. But in my view, if we introduce the electro-homeopathy to that patients, and if they get the good results and the disease will be cured very soon without any of the harmness, then it will be more good for our country. So our country's main objective is also to remove the leprosy as well as TB as soon as possible. And our Prime Minister and Health Ministry is also working on all these projects. So I'm very much congratulate to all of you to help me to come to know the knowledge of all electro-homeopathic medicines regarding related to these diseases. For that, I want to take some views and suggestions from all of you. Thank you, sir. Thank you.
Thank you very much, Mrs. Mohanty. It is a pleasure to see people like you come on stage in the field of microbiology. And as you know, Dr. Harold Huda has been associated to JALMA over the years and has been doing a lot of research there also.
Okay.
As ERF India and as the acupressure forum on by Dr. Bojraj, we offer our full services to you, acupressure and acupuncture, as well as electro-homeopathy. Whatever knowledge base is required will be made available to you. And we would like to participate in as many research forums at JALMA to make this viable. The vision to eliminate leprosy and TB and reach the root cause and cure it once and for all.
Yes, sir.
It's a pleasure to have you on board.
Thank you, sir.
With this, I would like to declare the session open, and we will, Dr. Meena, I would like you to quickly announce a sequence of people participating, and then from there, hand over the stage to Dr. Harold Huda to start his session.
Okay, the order of sequence is Dr. Huda will be coming first, talking about the legality of electro-homeopathy and introducing electro-homeopathy, the fundamentals. And second will be me. Third is Devasena. Fourth is Rafiq. Fifth, Shanta Francis. Sixth, Sri Rama. Seventh is Rini. Eighth is Bushra. Ninth, Sujata. And 10th will be Gigi, sir. So I now request Dr. Huda to come on stage and talk about electro-homeopathy. All of it. Welcome,
As you
sir.
all know, Dr. Huda runs a 100-bedded specialty hospital in Sambal, an allopathic hospital, where all extremely difficult cases are taken over by Dr. Huda, and he has been curing the patients of their ailments and their acute, chronic, and life-saving conditions using electro-homeopathy. Now, the beauty of Dr. Huda is, last 25 years, he has been conducting various sessions all over India, trying to train the people on electro-homeopathy. The latest is where he clubbed the 5-element theory and the traditional methodology used by Ayurveda and others over thousands of years, using the Panchabhuta or the 5-element theory and electro-homeopathy. So, Dr. Huda, welcome, sir.
Thank you. Good morning to all of you. Today, we have 10 presentations, including me. So time is very short. I will not take more time. And just I will introduce the system in a very short manner. So electro-homeopathy is a plant-based system. These medicines are prepared from plants, and there are many plant-based systems in the country. But what is the difference between the other plant-based system and electro-homeopathy? So the main difference between the other plant-oriented system and electro-homeopathy is the method of preparation. These medicines are prepared by a unique method of preparation. That method is called spagyric method, and in that method we collect the plant active molecules, or we can say we collect the synergy of plant, and we use this synergy of the plant on the human body. That's why these medicines are no known side effects, and with our organization, Electro-Homeopathic Research Foundation, we are working with many government or non-government organizations like CSIR, ICMR, and SCRBD, and some other private organizations. And we are working for the promotion of electro-homeopathic medicine in India. So as per the legality of electro-homeopathy, so practice of electro-homeopathy in India is totally legal, and government issue a policy decision on 25th of May 2010 that we can do the promotion, research, and development, and government is in process of making a bill, and government is finding the viability of electro-homeopathy for the recognition, and government of India made a committee. That committee is called IDC, and IDC is reviewing the electro-homeopathy, and from the ERF side, Dr. Vijayakant Agnihotri was earlier giving their presentation. Dr. Vijayakant Agnihotri present electro-homeopathy in front of IDC very well, and the process of recognition is going on. And in 2015, we make a merit in the Supreme Court and make a party to the central government, and central government give a counter affidavit to Supreme Court that there is no ban in the practice, education, and research of electro-homeopathy, and on behalf of that, Supreme Court give an order that you can do practice and research in electro-homeopathy in India. So right now, as per the view of central government, Ministry of Health and Family Welfare, and as per the Supreme Court order, the practice of electro-homeopathy is totally legal in India, and very soon government will recognize it, and we are working for the promotion of electro-homeopathy. So, my words. Thank you.
Okay, thank you very much, Dr. Huda. I would request Dr. Hemlata to say a few words. Hemlata, please come online. Dr. Hemlata?
1 second, sir. I have to unmute her. 1 second, sir. I'm doing it. Sir, Dr. Hemlata is not. 1 second. Yeah, ma'am, please unmute yourself.
Yeah, is that okay?
Yeah.
Yes, now audible.
Welcome, Dr. Hemlata.
Thank you.
Before we continue the actual presentations, I thought it's only fair to allow you to say a few words. And being an MBBS doctor with over 30-40 years experience in the army and as a retired colonel, hats off to you. Welcome.
Thank you. Thank you, Gigi. Thank you so much for inviting me over as a guest of honor. So I've already been introduced as a medical doctor. After I finished in 2000, I think I went into the energy systems. Of course, we all go into Reiki and pranic and all that, acupressure. And I think since the last 8-9 months or so, I've got into electro-homeopathy. What I found fascinating, the best part about electro-homeopathy, in my view, is that we diagnose allopathically and treat homeopathically. I think that is fantastic, because diagnosing allopathically is quite easy for me. And then getting it into homeopathy, because I've always been fascinated by homeopathy, by the classic homeopathy. And now EH is so much simpler to study and treat, and the results are very quick. Secondly, there are no side effects. And thirdly, you can take them with any medicines, with even coffee and tea, you can have it. So it's a really, really wonderful. And the few cases that I have been treating, the results are 100%. So thank you so much. Thank you, Dr. Huda. Thank you, Gigi. Bye.
Yeah. To this, before we continue, I'd like to say a few words for which I think Dr. Agnihotri will concur with me, and of course, Dr. Huda. Most of the other forms of medicine work at the primary metabolism state, while electrohomeopathy goes straight to the glandular area and works at the secondary level. So you can consume electrohomeopathy medicines along with other medicines also. It does not matter. Electrohomeopathy still works, right? Dr. Meena, take over, and welcome, Dr. Meena. Dr. Meena is an acupuncturist, is an acupressure specialist, and various forms of alternative treatment. She's also a dental surgeon. And along with dental surgery, she has specialized in alternative medicine. Welcome, Dr. Meena.
Thank you, sir. So today we'll be starting with our 9 presentations. I'll be talking, my topic today will be role of EH remedies in management of chronic diseases in the elderly. Sir, I want you to start the presentation, Dr. Huda.
Yes.
So meanwhile, hello and good morning to all of you who have come in Zoom right now. And I'm very excited to be in this today's community where rich people with rich Eastern knowledge have come together. It's very compelling and fascinating to be here. And I thank Dr. Huda and Dr. Girdhar Gopal for giving me and presenters an opportunity to share our experience as EH practitioners. And I welcome Dr. Bhojraj and Dr. Hemalata, and Dr. Vijay Kumar Agnihotri, and Pooja ma'am, Pooja Mohanty. I'm very honored to be with you all today. So I am talking about 2 cases. Case number 1 is 85-year-old female from Mysore, whom I met with lot of severe pain and swelling in both the legs, right from the pelvic joint till the feet. And she had complaints of recurrent urinary tract infection since 3 years, and pain during micturition, especially during the night, very dark and smelly urine, unable to pass urine in the daytime. So she also gave me a medical history, past history of suffering from hypertension for 30 years under medication, umbilical hernia, fatty liver, gout, arthritis of major joints. And my observations told me that she is of a mixed bilious temperament, a tall and hefty personality, a foodie, loves to eat, and right now, a non-ambulatory, weak, calm, and composed, where her quality of life was compromised. The pathology reports confirmed the presence of uric acid, high uric acid levels, ESR, and urine had a lot of pus cells and albumin, all prompting me towards the diagnosis of progressive pyelonephritis with gout. So these are some of the blood reports. I'll not go into detail. And on September 30th, I gave her electro-homeopathy medicines with a combination of S6, Ver1, C6GE in a strong dilution. And you can see the result within 15 days, the edema has come down, and I was zapped with the results I saw. Then we continued with Uticare, Stolin for urinary infection and kidney support from October till December. Then she has significantly enjoyed a good healing from then on. And we have started Hemzias, Neurozias, or all our patent medicines from Nadzias, and which is Neurozias has helped her, the nerve food, a lot, and she has been feeling very strong and healthy of late, and the color and smell of the urine is coming back to normalcy. She is able to pass the urine in the daytime, and the green ointment which we gave for local application has given a lot of relief when it comes to pain during micturition. So she is enjoying the quality of life after starting EH along with her allopathic medications. This is my point here, what I want to stress. And case 2 is a 63-year-old male. He is from Chennai. He had a heart attack on 10th of March and with all the typical heart attack symptoms, and he was admitted and angioplasty was done and a stent was placed. And this is the audio which has to be played, Dr. Huda. The patient will speak to you. If it can be played, sir. And these are some of the pathology reports of the patient. And okay, since less time, I'm trying to concise everything. This is the very essence. This slide is the very essence of my entire presentation. there are two cases which I just now spoke of. One where the patient already had a long process of suffering on medications, and then the electrohomeopathy was introduced. And another case, again, after the heart attack, this person has started electrohomeopathy. So here.
Wonderful.
Okay, and
Dr. Huda, are we able to take the audio?
Yes,
Can you play the audio?
sure.
not able to play, sir.
Trying, wait.
Shall I continue?
Mm. Actually, I'm trying to play the video, but it's not.
Okay, doesn't matter. This was
Okay.
audio provided by the patient himself, and very interesting that after this very patient started practicing electrohomeopathy. This is the beauty of electrohomeopathy. Okay, Beena, can we move to the next presentation?
Sir, can I end my presentation in 2
Yes.
minutes? Okay.
Yes.
So my point here to leave a message with you all is that we have a choice of either choosing a preventive care or palliative care. Basically, there is a need for a shift in our thinking, knowing our present age, health condition. We can all
I'll
always
try to
choose
play the
preventive care
audio.
and pick up early if you have the disease or okay.
Yeah, continue, Beena.
Yeah, continue, Bina. I'll play the
Yeah.
audio once you
Okay.
finish it.
Or the other choice is taking aging and health for granted. And when stuck with the attack, diagnose according to the patient's anamnesis, whatever they can recollect, and then based on the characteristics symptoms of diseases after the blow, then deal with it with medications and surgery. So this choice, if it is taken wisely, along with or supplementing or augmenting with electrohomeopathy, these are the two cases which has beautifully shown us that when along with regular medications, if you adopt and augment your electrohomeopathy medicine remedies, then this will definitely significantly improve and give quality of life to the elderly, and they'll be more productive, and even the health cost will care cost will come down. This is what is the message I want to live, because in my experience, what I observe is that this system, electrohomeopathy, works in that one space, the talking space, which we call the 0-point field, where the magic happens, where the conscious and the subconscious meet. And this is the space where the healing happens. And I'll not be wrong if I say that this works there. Very happy to be here with you and giving you the presentation. I'm sorry if I've hurried up, and thanks for listening. And I call upon the next person, Dr. Devasena, to come. Yeah.
Dr. Bina,
Yes.
may I play the audio if you would like to play it?
Yeah, please. Yeah, please. Thank you.
Please, please give me a minute. I'll share my screen.
as special as we are in electro-homeopathy, I think we lack in some presentation skills. So let's move to the next presentation. Thank you, Priyatam. Bina, can we come up with the next person? Because then we'll take on data. Next time, I think we'll have a better, faster system of playing such embedded audios, right? So, who's the second speaker, Bina?
Devasena, sir. Devasena.
Devasena, welcome.
Welcome.
Introduce yourself quickly. You have 5 minutes to finish your presentation.
Sorry, sir, since I'm joined through mobile, I could not able to share that audio.
No issue,
I
no
will
issue,
try.
no issue, no issue.
Pritam, are you sharing the Devasena presentation?
No, sir.
Yes, Dr.
I
Huda,
stopped sharing.
Dr. Huda,
We
you
can
will share it.
Okay, okay.
All presentations will be Dr. Huda. Welcome, Dr. Devasena Chakravarti. Please introduce yourself in 10 seconds and take over the case study. Devasena, unmute yourself. Press on the mute button. Devasena, you're muted.
1 second, sir. I'm unmuting her. Yep. 1 second.
Welcome, Dr. Devasena.
Morning, sir. Actually, I was not unmuted for a long time, so I was waiting the host to
Thank you.
unmute me. Sorry
Sorry,
for
yeah.
the delay. So I was, I was waiting for the host to unmute me.
Right, okay. Please take over.
Okay. Good morning, everyone. This is my case study about the cervical spondylitis patient. Actually, she is a 47-year-old lady. She was already, she was having, sir, you can move on the screen, sir.
Whenever you require the slide mode, you just say next,
Okay,
and Dr.
okay.
Huda will shift it to the next slide. Next slide, sir.
Next slide, sir, please. She is a married and lady, and she has 2 children. Actually, past history, she was suffering from a type 2 diabetes, but she didn't take any steps to control her diabetes. She was now and then taking Siddha medicine for the past 6 years and has PCOD, fatty liver, and she is much obese, umbilical hernia. She is suffering from umbilical hernia. Due to umbilical hernia, she is having lots of digestive issues also. And this umbilical hernia has led to urinary incontinence also in herself. So next slide, sir. And the present history, she came to me with a severe pain in her neck and that radiated to the left arm till the fingertips. She couldn't lift her arm also. She couldn't turn her neck or bend her neck. Then with the symptoms and diagnosis, as I'm an acupuncturist, I felt the pulse and then I found that she has severe cervical spondylitis symptoms. Then I started treating. And these are the indications she was having. As she is in the premenopausal symptoms, she has now and then has hot flushes and irritation. Anger, depression, she not much, but still she was telling me that she had some depression mood swings also. Then I started treating her with EH medicine. So next slide, sir. So next slide, please. And okay, this was the medicine given by me, S5, L1, A3, F1, C4, and RE. First, I started with the D5 solution, D5 dilution. And she was very prompt in taking this medicine because she was suffering like anything. Within 1 week, she had much difference in her attitude and everything, because I'll explain it later why I chose all this medicine. Then she had taken the medicine for past 3 months. Then that severe pain has much reduced. Now she is having only the tingling sensation in the left arm, but still she is continuing her medicine now. Now, next slide, sir. I will explain why I have chosen these medicine for her. I chose S5 for her left side remedy because the pain was radiating on the left side alone, not on the right side. So S5 as beriberi is there, that plant beriberi is there. It works very well for the wandering pain and also for arthritis. Then I chose L1 as a painkiller. So the pain has reduced much because of this L1, and the numbness which she felt also reduced. And it may work for the obesity and diabetes, as already she is a diabetic patient and obese. I chose L1, so it works for obesity and diabetes. Then A3 again, it is for the wandering pain, and also she is having hot flushes now and then because of the premenopausal. So I gave that A3, and also this A3 strengthens the weak stomach also, as she's having digestive issues. Then I chose F1, which is for naturally, it is, as we all know, that F1 plays a great vital role in the nervous system. Then C4, because it is like arthritis, osteoarthritis, I chose C4 for the bone remedy. Then I chose RE for the nervous system, which reduces the pain in the shoulders and the neck area. And next is the A3. That is the, sorry, once again, it is works as an anti-inflammatory for the blood vessels. So please move the screen little bit down, sir. A2, actually, sorry, I have typed as A3. Last one is A2. I have given A2 for compressing the neck, and it is an anti-inflammatory, and also it is for the blood vessels and improves the blood circulation. I have chosen A2. Sorry, the last part is A2, it's not A3. So these were the medicines given to her, and now she is feeling much better, and she didn't go to any allopathic doctor. She directly came to me and approached me for this condition. So I don't have any X-ray. Through acupuncture and this mainly this EH medicine was given to her. Now she's feeling much better, sir.
Thank you very much, Desena.
Thank you, sir.
Yeah, Bina, can we take on the next presenter?
Yeah, I call upon Dr. Rafiq to come in. Dr. Rafiq, welcome. Priyatam, can you please unmute Rafiq, sir?
Dr. Huda, can you bring in Dr. Rafiq's presentation?
Yeah, actually, Dr. Rafiq, I couldn't find his name. I'm enabling all unmute option. So, Dr. Rafiq.
He's
yes,
listed
okay.
as Dr. Sheikh.
Okay, he's there.
Unmute नहीं हो रहा था.
Right.
Dr.
Now it's
Sheikh.
okay. Yeah. Please go ahead, sir.
Wait.
Just one update, in case if you find any background noise, I'm traveling, so please bear with that while I'm talking. Other times I'll be on mute.
Oh, sure. Dr. Rafiq Ismail.
Yes, sir. Good morning.
Welcome, sir. Dr. Sheikh Rafiq Ismail is from a remote area in near Pune, and he has to his credit wonderful experience using electro-homeopathy. Dr. Rafiq.
Yes, sir. Namaste. I am a electro-homeopathy practitioner in practicing 7 years. मैं आपके सामने एक केस हिस्ट्री रखना चाहता हूँ. सर, मैं आवाज ऑडिबल?
Yes, go ahead.
Yes. तो एक जमाना केस का स्टडी करना चाहता हूँ. Patient is a female, age 21, chief complaint itching and constipation, sleep disturbance, medical history, and BP 120/80 was 75 आणि मेनोपॉजल डिस्टर्बेंस. तो एक्जिमा एक ऐसी बीमारी है जो जिस त्वचा से खुजली होती है, और खुजली के बावजूद कुछ लोगों में यह समस्या इतनी बढ़ जाती है कि तकलीफ हो जाती है, और तकलीफ इतना उन्हें इसका लंबा ट्रीटमेंट भी करना पड़ सकता है. मौसम के बदलने से समस्या और बढ़ सकती है. कुछ लोगों में इतनी तेज खुजली होती है जिसमें त्वचा से ब्लीडिंग खून भी आता है. तो मैंने उनको ट्रीटमेंट दिया इलेक्ट्रो होम्योपैथी, एंजाइटिको 2 S5C3 वर्मीफिगो 1 and glynicity 10th dilution, and एंजाइटिको 2 scrofloso 5 and canceroso 5 वर्मीफिगो 2 APP and glynicity अप्लाई नीम ऑयल. तो मुझे फर्स्ट वीक 7 डेज में नॉर्मल थोड़ा सा प्रोग्रेस दिखा. उसके बाद में 1 मंथ गुड परफॉर्मेंस, फिर 2 मंथ 80% गुड रिजल्ट, एंड 4 मंथ कंप्लीट क्योर इन एक्जिमा डिजीज, एंड ट्रीटमेंट डन. Thank you, sir.
Fantastic. Fantastic. Thank you, Dr. Sheikh. Wonderful.
Thank you. I call upon Dr. Shanta Francis to come in.
Hello, good morning, everyone. I am Shanta Francis from Chennai. I am basically a teacher teaching biology in the school. When I was affected by chikungunya in 2004, everybody, you all know it, then I was completely paralyzed. So I was taking the acupuncture, that which I did not know. But then I took it for 3 months, then I was completely cured because my deformed hands and the rheumatoid problem, everything was solved. So I took up the study of acupuncture. That is from basic to diploma, master diploma, then PhD and MD and everything I completed. Now I am practicing this for 12 years along with EH medicine. So EH medicine, I got it because of the instant help, somebody had helped me. So I did this study also. So it is very helpful to me. This is what I am treating now at present for 12 years. Go ahead, sir. Please roll it up. Not this one. Not this one, sir. Yeah. Just not this. Scroll it up.
He is closing it, ma'am.
So my case study I have taken up is this one. Third, that is actually just gastroesophageal reflux disease, that is which leads to functional gastrointestinal disorder. Just to scroll it up. So this boy actually, I have got 40 pages of reports from this boy from the age of 10 months. From 10 months to 9 months, he was having the only allopathy medicine, which was treated by a pediatrician. He was taking only to the particular doctor. Then after 9 years only, he had come to the other doctor, and she had perceived that he has got some stomach problem. Otherwise, because of the medicines he had been taken till 9 years, he was having lot of problems like, he got a stomach pain and a loss of appetite, and whatever he was eating, soon after eating, he was vomiting. And then the constant stomach pain means the child could not go to school. And his stomach was like a balloon when he came to me. And that constipation, it was so, when he touched the stomach, it was so hard like a lump. And then the parents also told whenever he goes to the to ease himself, no, that funky smell, that gas was unbearable. And then he had also, due to that stomach heat, he had got a mouth ulcer. And then he was introduced, because as a child, he was introduced to something, Aphthalina, I think, from in the beginning. So till the last of 9 years, he was having the same medicine. And then he was taking that, since he was taking so much of that medicine, all this complication has taken place in his stomach. And then finally, he has become a victim only, I can say. Poor child. And he is, he was very, when he came to me, he was a very lethargic boy. He was very afraid. When I called the child, "Beta, please come, what happened?" Then he hid his face on the chest of his mother. So much afraid. Then when I asked about the school, and he was also telling that he has no friends, he doesn't speak with anybody, and like that. Till then, he was having this such a problems. And since 10 months it is given, 10 months he was taking the treatment of the medicines, he was unable to tolerate that pain. So then finally, one of the patient who was the polycythemia patient, he was got completely cured. He has introduced this man to me. And then when he came, he was having all these complaints. So then I started giving the medicine. First, I did only acupuncture because I did not know, because since he was a boy, I asked Dr. Hudaji also, can we give EH? He said, okay. So first day when he came, I gave only acupuncture points. Just take it up. And he was taking a lot of, since for many of the reports, it was not able to put it here. So I just put 1 or 2 only. So he was taking, since he was taking the painkiller was so many. So I just give according to our medicine, S5, C5, F1, RE or GE. Since in the first beginning, he had so much of pain. So I added GE, and this S5, C5, F1, RE, this is the analgesic drops, which I use it for everybody. So this one, what I did, I put it in a 30 ml that you all know it. And I like a spray I gave to the patients. You can just apply it whenever he has the pain. So as a painkiller, this S5, C5, F1, RE or GE. So according to the condition, we can use it RE or GE and all I did it. Then that actually the boy was having the stomach pain. He was not able to eat whatever he was eating. He was having that tendency of vomiting. So I gave S2, C15, A3, BE in the neutral dilution only, because the first time when the child is coming, no. So I gave only 5 drops 4 times. Then second one, after food, I had given him S10, C10, F2, W. That also in neutral medicine only 5 drops to take it for 4 times. Then since his report showed that he was having constant cold, cough, and he was using the nebulizer in the hospitals and all, then I just gave it in the hand. Whenever it is needed, he can have it P1 or P2 and F1W. So when he was having only the running nose, so I just gave P1, running nose, sore throat, ear itching, eye itching. So many complications when they explained, I put P1. P2 means when the child was having some congestion, the cough, like that, phlegm is there. So I had given P2 also. Then at present, later, recently, I have given, since our medicine, I am a fashion of our medicine, because our medicine is full of only without any RS. Because other medicines I have used RS and I got a problem with my eye also. So I have given only our medicine, Huda's medicine I used, and this chest ointment is working excellently. Because when my mama is 86-year-old and I have given her also the just to apply it on the chest. So I have given this chest ointment also in the hand. Now for the aloofness, the child is, the beginning, as I told you, he doesn't speak to anybody in the school. Even someone beats, he comes and cries at home, it seems. And he was very fearful child. So for that, I gave Neurosis to take him 20 drops. Now, day for yesterday, when he came, he was very happy. He's very, you may not know. See, at age of 9-year-old, how smart they will be, how they will be running here and there, restless people. But this boy is so nice now he can talk, and when I ask him anything, auntie, I am very nice, I am feeling okay, I have got a lot of friends. So that is which I feel it very happy. In the school and all, when you have no friends, what the hell it is, I can understand as a teacher. But then he was having lot of friends and he was doing all happy and doing the homework and eating. The one thing, whatever he is eating, everything he is eating. Before he was selective, but now he is eating everything without any problem. So just to play the audio. So his mother has given the audio.
Can you play the audio, Dr. Huda?
Yes, Gigi sir, I'm trying. Wait.
Huda sir, escape the slideshow mode and click on that volume icon. Yeah, and we may need to choose the option share sound in the Zoom settings. You know, in the three dots. If you choose the three dots, you have a
Share sound. Already
yes. That is the option you need to select. Now play it, sir. Still not able to hear.
You are not able to hear?
No, sir. That
No. Okay, let's move on, sir. We have a lot to learn in Zoom also.
Shanta Francis,
Now
she gave
able to
EH
share?
medicine. After using that, he is quite okay.
yes, sir. Now able to hear.
Habit is also good. Because, good evening, ma'am. I am Kausalya and my son is Gautam Krishna. He has been struggling from stomach pain, constipation and mouth ulcer, as well as if he release gas, it gets bad smell. Then we consult Dr. Shanta Francis. She gave EH medicine. After using that, he is quite okay. And his eating habit is also good. Because before he eat only selected vegetables, now it's get better. Thank you.
So thank you very much, sir, for giving me.
Wonderful. Mrs. Shanta Francis is
Yes,
a
sir.
school teacher and an electro-homeopathic practitioner. Thank you very much, Shanta.
Sir, I would like to add this, that the case I presented, the second case of heart attack is Mrs. Shanta Francis' own husband. And she herself was the person who gave the first aid when he had the attack. And with electro-homeopathy, he recovered from the chest pain. After 3 rounds of administering the electro-homeopathy, he completely recovered, and then he walked himself to the hospital to get an ECG done. And then everything followed. And it is
मैडम जरा हिंदी में बना बोलने की तरह तस्ती लीजिए मैडम,
has,
सारे लोग इंग्लिश नहीं समझ सकते, हिंदी चलेगा, गुजराती भी चलेगा।
अच्छा, ये जो शांता फ्रांसिस ने प्रेजेंटेशन की अभी, उनके पति का केस ही था जो बीना मैडम ने प्रेजेंट की थी। उनको खुद को ये हार्ट अटैक हुआ था और स्टेंट लगाया गया। पहले ये तकलीफ होते ही डॉक्टर शांता फ्रांसिस ने इलेक्ट्रो-होम्योपैथी स्टार्ट की एंड मिस्टर फ्रांसिस खुद पैदल चल के गए, अपना ईसीजी वगैरह निकलवाए और उसके बाद कार्ड क्योर नाम का चीज जो डॉक्टर हुडा ने एक पेटेंट मेडिसिन निकाले हैं, उसी के अधीन है and he is very happy with the product.
Yes.
Thank you very much, Shanta.
He's been using card cure as electro-homeopathy medicine, supplementing his regular allopathy medications, and he feels much better when it comes to his strength and quality of life after starting EH along with allopathy medication. Sir, Dr. Huda, if you can play the same audio using the same method.
Later, right now, go on to the next
presentation.
I would like to say about the external application. I would like to say external application. Shall I say?
Yeah.
What was given to Francis?
Yes,
we don't have time today, dear. Next
2
presenter.
minutes. 2 minutes.
Who's the next presenter, Beena?
Yes, sir. Sri Rama.
Wait.
Priyata, please unmute Sri Rama.
Who?
Yeah, she can unmute herself. Shirama, you can unmute.
Okay, thank you, Priya.
Veena, actually, Srirama is not here. She
10th
has gone
April
out.
2021, early morning,
Audio is
around
audible?
8 a.m. I had
Audible, sir.
chest pain. The pain was terrible. Immediately, Dr. Shanta gave the first aid by giving EH medicine, also acupuncture. I felt better. But since I was not sick till then, till the age of 61, we went to the hospital to check it. What happened? The hospital, they took ECG and immediately got us admitted in the hospital and then told us that I had a heart attack. And they admitted me in straight away in the ICU because my life is in danger. Then they said next morning they are going to perform angiogram, but they did angioplasty and kept a stent. Ever since I was kept stent, they prescribed me a lot of medicines. I took and I lost weight from 75 kg to 55 kg. Dr. Shanta met Dr. Huda and he suggested card cure for me and other medicines too. I was taking card cure. I felt much better. Now I am feeling much better and I have gained weight from 55 to 61. Feeling better. So whenever I meet my cardiologist every 3 months, he always asks that I should go for a bypass surgery because there could be a block. I reject bypass surgery and I accept EH medicine. Since Dr. Shanta is giving me regularly the medicine and taking care of me, why should I go for a bypass surgery? I don't need it. I think with EH medicine, all heart problem and card cure can help everybody. Thank you.
Wonderful, Bina. A wonderful presentation.
Thank you, sir.
Let's drop Srirama. Who's the next presenter?
Rini, sir.
Rini.
Welcome,
Hi, Rini. How are you?
Yeah, all good, sir.
Rini is an acupuncture.
No, sir, homeopath.
Homeopath, yes. And recently she was introduced into electro-homeopathy and she's been enjoying herself with electro-homeopathy. Welcome, Dr. Rini.
Thank you,
Dr.
sir.
Huda, can you bring up Rini's presentation?
Sure.
Good afternoon, everyone. I'm Dr. Rini, a homeopath from Bangalore. Over 6 months in the field of EH and experiencing the wonderful healing power of EH medicines. Yeah, today I'll present a case of hypothyroidism. The patient.
मैडम थोड़ा हिंदी में बताइए तो अच्छा रहेगा.
मुश्किल है,
उनको हिंदी नहीं आती है।
जहां जहां जरूरत है मैं ट्रांसलेट करूंगा।
Thank you, sir.
ये
Okay, thank you, sir.
हाइपोथायरॉइडिज्म पर केस है। Go
Yeah.
ahead, Rini.
Yeah. The patient is a female. Sir, next slide.
Next slide, sir.
Yeah, the patient is a female, 36 years old, homemaker, and she came to me with the following complaints: tiredness, hair fall, irregular periods, then forgetfulness, palpitation on walking, and weight gain. She was worried about her weight gain, and she had complaints from exposure to cold, especially headache.
जैसे ये पेशेंट 36 साल की है, एंड उसे कंप्लेंट था, टायर्ड रहना, हेयर फॉल था, पीरियड्स इरेगुलर थे, फॉरगेटफुल, याददाश्त बहुत कम हो गई थी, पैल्पिटेशन तो होता ही था। ये सारे मेडिकल टर्म्स इंग्लिश में ही हो सकते हैं, तो आई विल नॉट स्पेंड मच टाइम। नेक्स्ट स्लाइड।
Yeah, nothing relevant, no relevant complaints in the past. And also the family, the mother was diabetic and the father is hypertensive. That's her family history. Yeah, her medical history, she was diagnosed with hypothyroidism 6 months back, and her TSH was 8.45, and she has started taking Tyronome. She was on Tyronome 25 microgram when she came to me. So I started with EH medicine around 15th September 2022. This is the previous report which she had. Sir, next slide, please. Yeah, on observation, we can say she was very friendly, but she was very much stressed about some family matters, children's studies, and her weight gain. She was very caring and friendly. I started with EH medicines, 5 elements medicines, patent medicines, earth tea and water tea from 15 September 2022, and asked her to continue the same Tyronome 25 microgram daily for another 15 days, and then taper it to alternate days for a month, and asked her to stop completely after a month. So she followed the same and she stopped the medicine. I also advised regular exercise and an appropriate diet for her. Yeah, so the treatment analysis, the pathology, considering the pathology, the hypofunction of the thyroid gland, and how I came to the medicines also, her caring and friendly nature, craving for sweets, tiredness, forgetfulness, and her overthinking nature, earth tea was prescribed. And for the other complaints, hair fall, complaints from considering the other complaints, the water tea was prescribed. So she was taking earth tea and water tea, 25 drops, thrice daily. And this is the final report. As on 8th January, her TSH has come down to 4.10 and all her complaints have subsided.
ये एक केस है जहां पंचभूता 5 एलिमेंट थ्योरी के आधार पर डायग्नोसिस किया गया और स्प्लीन एंड किडनी पर काम किया गया था। पेशेंट फुल रिकवर हो गए हैं। थैंक यू वेरी मच Rini.
Thank you, sir.
Meena, can we move on to the next person?
Sir, Devasena will be presenting Sri Rama's case.
Oh no, it's later. Now Sri Rama is out. Move to the next
Dr.
one.
Bush. Okay, then Dr.
Bushra. Dr. Bushra.
Yes.
Dr. Bushra, unmute and come online. Hi, Dr. Bushra.
Hi.
Dr. Bushra is basically a microbiologist, correct?
Yeah.
And she has been looking after the pediatric wing and the gynecology wing in the 100-bedded allopathic hospital in Sambal, which is being run beautifully, where we have electro-homeopathy from the reception to the NICU. That's where you'll find Dr. Bushra. She has had wonderful, wonderful cases of childbirth with chronic and very difficult matters to handle. I call her a terrorist. She's wonderful with electro-homeopathy. Bushra, please take over.
Okay. Good afternoon to all. जी सर ने तो बहुत सारा बता ही दिया है। फिलहाल जो मेरा टॉपिक है यूट्राइन फाइब्रॉइड है। बहुत सारे केसेस ट्रीटेड करे हैं, जैसे ओवेरियन सिस्ट का, यूट्राइन फाइब्रॉइड्स का, जो ओनली एंड ओनली ईएच मेडिसिन यूज करके ही हमने ट्रीट करे हैं। बट जो आज का मेरा केस स्टडी है वो थोड़ा सा डिफरेंट है, और केसेस जो थे मेरे यूट्राइन फाइब्रॉइड के वो नॉर्मल पेशेंट के थे। और ये जो है मेरा पेशेंट प्रेग्नेंट था, उसको यूट्राइन फाइब्रॉइड पहले ही थी, बट वो मेरे पास अभी प्लीज शो द स्लाइड। ये पेशेंट था, इसकी शादी को 2 साल हो चुके थे, और इसकी पास्ट हिस्ट्री थी कि इसको 1 साल पहले मिसकैरेज हो गया था। इसके 14th वीक से इसको थोड़ा पेन स्टार्ट हुआ था, एंड 16th वीक तक आते आते इसका नेचुरली मिसकैरेज, मतलब इसको कुछ ऐसा प्रॉब्लम आई, ब्लीडिंग वगैरह हुई, और उसके बाद इसका मिसकैरेज हो गया। तो ये मेरे पास पेशेंट आया था 8th वीक में आया था। इसको जब पता चला कि इसको दोबारा से कंसीव करा है इसने, तब ये मेरे पास आया था। और इसको प्रॉब्लम रहती थी कि इसके लोअर एब्डोमेन में हल्का हल्का सा दर्द हमेशा रहता था। इसके बाद मैंने इसको एडवाइस किया अल्ट्रासाउंड के लिए। जब इन्होंने अल्ट्रासाउंड कराया तो 12 वीक्स की प्रेगनेंसी थी, और साथ ही साथ इसको एक मायोमेट्रियल फाइब्रॉइड थी 3.3 बाई 2.7 बाई 2.6 सेंटीमीटर की इसको फाइब्रॉइड आई थी। बाकी इसको कोई प्रॉब्लम नहीं रहती थी, सिर्फ इसको लोअर एब्डोमेन में भारीपन सा महसूस होता था। उस समय मेन कंसर्न था कि पेशेंट को एक बार पहले भी मिसकैरेज हो चुका था, और अक्सर ऐसा होता है कि जब फाइब्रॉइड होती है और उसके साथ प्रेगनेंसी कंसीव होती है तो पेशेंट को मिसकैरेज के चांसेस ज्यादा रहते हैं। तो पहले तो हम लोगों ने उसी के लिए उसको मेडिसिन दिया, S2D वगैरह दिया, और कोई बहुत ज्यादा मेडिसिन उसको हमने फाइब्रॉइड के लिए नहीं दिया। नेक्स्ट उसका अल्ट्रासाउंड हमने कराया 25 वीक में। तब उसका जो फाइब्रॉइड का साइज था वो और थोड़ा सा बढ़ गया। तब उसका साइज हो गया 3.8 बाई 3.7 बाई 3.7 सेंटीमीटर। देन जो उसका पीरियड था, जब उसको पहले भी मिसकैरेज हुआ था और अभी हम सेकंड ट्राइमेस्टर भी हमारा कंप्लीट होने वाला था, तो हमने इसको फाइब्रॉइड के लिए मेडिसिन स्टार्ट करा। उसको हमने मेडिसिन दिया S211G लाइटर में और C4S10 L1WE। इसको मेडिसिन देने के बाद में 35 वीक्स पर हमने इसका रिपीट अल्ट्रासाउंड कराया, और तब पेशेंट को कोई फाइब्रॉइड नहीं थी। कुछ कंडीशंस ऐसी बनी, नंबर 1 के बच्चा जो था वो ब्रीच था, और उसके जो कॉर्ड था वो नेक में था, तो पानी की भी कमी थी, ओलिगोहाइड्रोमनियोसिस था। इस वजह से हम लोगों ने डिसाइड किया कि इसका LSCS होना है। तो तब पेशेंट का LSCS हुआ और पेशेंट का यूट्रस एकदम हेल्दी था, अल्ट्रासाउंड में भी नहीं आया, उसका कोई भी कंप्लेन, और अभी भी पेशेंट एकदम से बिल्कुल फिट है। और उस थैंक यू।
Wonderful. One of the most beautiful things in this presentation, all of us should see a wonderful way of presenting. The main report next to you on the left, on the right, the highlight portion. Thank you, Bushra.
Thank you.
Wonderful. The next
Thank you,
presenter,
Dr.
please.
Bushra.
Thank
Yeah,
you.
I call upon Sujata. Dr. Sujata, please come.
Good afternoon to everyone. So today I'm presenting a case, breast cancer. Would sir please
Sujata presentation, sir.
A dentist specialized in oral medicine and radiology. So learning a lot of various alternative therapies.
Gopal Singh Kaler, mute kariyo.
Priyam, please put the mic to her.
Some
Sujata, unmute. And start.
Good afternoon, everyone. Myself, Dr. Sujata from Bengaluru. So I'm basically a oral medicine and radiology specialist, learning various alternative therapies from 10 years. So latest from 1 year, I have been learning electro-homeopathy under the guidance of Dr. Huda sir. So this today's case presentation is on breast cancer patient. Huda sir. Is it opening, sir? PPT? First page, sir. Yes, sir. So here today I am presenting a breast cancer with distant metastasis with palliative management with electro-homeopathy. Patient, next slide, sir. 72-year-old lady. Patient husband visited to my clinic with the complaint of this breast cancer. They were not having any children. They visited to the cancer hospital with the diagnosis of breast cancer with the metastasis. So they were not willing to go for the chemotherapy, radiotherapy. That is why they approached us for the alternative therapy. Last year, February, they came to our clinic in Bengaluru. Next slide, sir. So chief complaint was painless swelling in the right breast from 6 months. It was increasing in size and later it stopped growing. Then she had a weight loss of 10 kg in 6 months. She was not having hunger, no sleep, and she was also complaining of knee pain on both the sides. She was not able to walk without any support from 1 year. And medical history, she was a diabetic. She's a diabetic patient from 7 years and she is on medication. Next slide. Her investigation reports, since it is an indirect case, she was a bedridden patient. She was not in a position to reach to the clinic. Husband got all the reports of breast cancer. Blood sugar was normal. C-reactive protein was increased. And tumor marker for breast cancer, there are many tumor markers. One of the tumor marker is CA 125 was very high. So next slide, sir. So tumor marker was suggesting that there is a malignancy in the breast. So there are many screening tests for the breast cancer: examination, ultrasound, mammograph, MRI scanning, biopsy. So based on these reports, the staging will be done for the breast cancer. So this patient got the reports of mammography. Next slide, sir. The mammography showed there is a frank malignancy in the right breast, that is BIRADS 5 grade, with the lymph node enlargement in the auxiliary area, even in the lymph nodes in the infraclavicular area. The left breast also showing a malignant lesion. Patient was not complaining of left breast, but in both the breasts, she was having malignancy revealed in the mammography. That is BIRAD 5 in the right and BIRADS 4 in the left breast. You can see the picture. This is a picture of not from the patient, and just for a better understanding, I put the mammography. So we can see the images of the malignancy in the breast here. Next slide, sir. Ultrasound for the abdomen and pelvis was done in the February month to see any ascites, that is fluid in the abdomen and pelvis. It showed grade 1 fatty infiltration of the liver. So usually ultrasound for the breast, this is the image it will be seen. First is the normal, second is the benign tumor. The third picture is irregular lesion we can see in the malignancy of the breast. Next slide, sir. The confirmation comes from the PET scanning, that is particularly F18 FDG PET scanning done in the month of March. So the impression of the PET scanning was carcinoma of right breast with the multifocal malignant lesions. So there are many interpretations. It's a very big report. There are many interpretations of the PET scan. So the scanning shows there is a metastasis to the auxiliary lymph nodes, and also there is a metastasis to the thoracic vertebra, and there is a chances of metastasis to the hip area. There was a fracture of the right femur bone and erosion of the femur head, and there was a metastatic likely to the gluteus muscles into the hip joint. So these were the interpretations of the PET scan. So after the multiple opinions and visits from the oncologist, gynecologist, and chemotherapist and radiologist, patient was not willing to go for the radiotherapy chemotherapy due to the side effects and the suffering. So they wanted to try the natural medicines with the guidance of Dr. Huda's group discussion. So we started electro-homeopathy for the patient as a palliative care. Since the patient, the final diagnosis was, sir, next slide, sir. It is a this is the PET scanning images. We can see here the metastasis to the different areas in the breast. The final diagnosis of the medical diagnosis is carcinoma of the cancer of the right and left breast with the metastasis to the auxiliary lymph nodes, vertebra, and hip region. So this is a stage 4 cancer where a patient is in a final stage with a lot of metastasis. So the survival rate for this type of a patient will be very less. Next slide, sir. So stage 4 breast cancer is also called as a metastatic breast cancer. We can see that based on the size of the tumor and the spread, there are stages into 1, 2, 3, 4, 5. So this is a 0, 1, 2, 3, 4. So this is a stage 4 cancer. There is no cure for this kind of a stage 4 breast cancer, where it has already spread to the different parts of the body. But patient wanted at least a minimal management of the lifestyle care. So we started palliative care in this patient with the electro-homeopathy. Next slide, sir. The survival rate, 5-year survival rate would be 86% if there is a spread to the lymph nodes. If there is a distant, far away spread to the other parts of the body, then the 5-year survival rate will be 29%. And there will be more of side effects from the chemotherapy, and quality of life will be very much reduced based on all these interpretations. Next slide, sir. So 5-element analysis showed a patient was in a lot of stress and overthinking and could not able to sleep, walk, take bath. She was totally depending on the husband. She was on the bedpan for the toilet, and patient husband visited. Every month he used to explain the monthly changes and used to collect the medicines for the breast cancer. She was suffering from a severe hip pain. because of this, could be because of the metastasis to the hip bone. So there was a fracture and erosion in the femur bone. She was suffering from the severe pain in the hip region. She was not able to get up and walk. Next slide, sir. So till now, the patient is coming every month and taking medicines. Next slide, sir. First visit, when there were less reports, we started with the C4L1A3RE for the local external application to the knee, since she was having a lot of knee pain. Then after the PET scanning reports, in the second visit, we planned this electro-homeopathy medicines, S2C2WE medium dose, S6C4BE stronger dose, F1A3RE stronger dose. So afterwards, the every month visit, in the next month itself, patient husband told that the nipple was retracted due to the metastasis, due to the deeper spread into the breast. And after the EH treatment, the nipple started coming out and the lump was very hard and the hardness of the lump started decreasing. Next, continuation. The size was reducing and back pain reduced, then hunger improved, sleep improved, knee pain also reduced. And every visit by visit, the hardness of the lump was reducing. And the few more changes we did it in the next visit onwards. Diet changes told with the nutritious food, since she was having a lot of tiredness. And the turmeric milk also suggested, til laddu was also suggested to just as a supplements to the nutrition. Next slide. Next, sir. So we also added the Sujok acupressure using the elastic ring and the Mutsa for the hip pain, knee pain, and the gem medicines. And red ointment also was given for the knee pain. So after, in the month of September, that is from the February till the August, she was not able to walk. But in the month of September, she started walking herself, going to the toilet, using the stick, taking bath, and lump started becoming softening. Next slide, sir. So this kind of a palliative care was obtained with the electro-homeopathy in this present case. So palliative care is basically focuses on the lifestyle, quality of the life for both the patient and the family. Along with the medication, the nutrition, the patient will be under stress, the spiritual support and the counseling, everything was included as a palliative care. Next slide, sir. It is a teamwork. The breast cancer management is a teamwork in the diagnosis. A lot of specialists will be there, even in the management. So there will be, along with the oncologists, surgeons, and radiotherapist, chemotherapist, it is like a group for the better communication, psychological and spiritual care. The other palliative care people also can be included. That is the experience we got from this case. Next slide, sir. Even though patient was in stage 4 cancer with the BRAD5, where patient will have a lot of metastasis and complications in the body, along with this EH, only with the EH and other acupressure and the moxa and the nutritional changes, patient is able to have a normal lifestyle, even though she is having a distant metastasis. So this is the experience I would like to share today's online convention on electro-homeopathy. Thank you everyone for giving an opportunity to share this case study. Thank you, Vanessa.
Thank you.
Wonderful. Thank you very much.
Sir, can we allow Devasena to present Shredana's case?
No, we will not. We want the practitioner who has practiced to do it. We don't want a third person presenting it. Then the whole idea of this session is lost. Okay? So we're not trying to sell our system. We want a practical experience.
No, sir, some emergency came in and she had to leave.
No issue. No issue. Okay,
then
next time.
it is
Always the next time.
Next case, the next presenter is you, sir.
Thank you very much. Before I start my presentation, We have 89 people on board. It is a wonderful gathering. Mr. Mujibur Rahman has shared a Google form. I would like all of you to fill up that Google form and upload it, because we will be having such sessions practically once in 2 to 3 weeks regularly. So to keep you all abreast of the developments, I request you to please share your information, which we will try not to misuse otherwise. Thank you. And Dr. Huda, can we come up with my presentation?
Yes, sir.
Wonderful. This is a case I'm going to present on a client of mine. I don't call them patients because they're not patients, they're a physical disorder. So he came to us one day. He had been having this liver issue since 2019. He used to be an alcoholic and had given up alcohol. And then we started with him. And first time he came, this was his condition. Next slide, sir. He had full ascites and a lot of water collected in his abdomen. So we had that drained out. Next slide. We collected about 6 liters of fluid from the abdomen. Next slide. Even after that, the left leg was swollen just the way as you see it. Next slide. After draining out 6 liters of water from the stomach, a couple of days later, this is how he was. This is our patient. Next. After 1 month of starting of treatment, this is how he looked. Next. As of today, this is our patient, Mr. Puneet. Now, the beauty is, he came to us in June, and by end July, the reports we have, so many reports from 2019 till today, show beautiful progressive improvement. And as of the August-September reports, he has been free of liver issue. He recovered fully, and subsequently areas like platelet count, etc. We're working on it. He's improving regularly. Now, moving away from convention, I am bringing the patient himself, Mr. Puneet Verma, online here. Puneet, you can say a few words.
Hello, good morning, everybody. I'm Puneet Kumar Verma, patient of Dr. Rehanal Hooda and Mr. Gigi sir. Actually, I came over here in June when doctors told me that unless a transplant, you cannot stay for a month or so. So I either had to die or die financially. So I decided to die the way I was. And God grace, I came to know about Giridhar sir. And at 11:30, 11:45, even Dr. Hooda sir had that patience and that kindness of his that he came on a Zoom call on 11:30.
At night.
at night and he saw my status and he told me to meet Dr. Giridhar tomorrow in his clinic. And today I'm here. After coming over here, I met Giridhar sir and he gave me the medicines, and after 3 weeks, I started recovering. And today I'm sitting in front of you all. And I'm very grateful to Dr. Huda sir and Gigi sir. Like, they are like gods for me today. If not, around in June or July, I wouldn't have been in this world. Thank you very much to Gigi sir and Huda sir. I'm very grateful and always be grateful to you.
Thank you very much, Puneet. So this is how electro-homeopathy has been working with us. So without much ado, I would like to hand over the stage to Dr. Bojraj, Dr. Hemlata, Agnihotri sir, and Pooja Mohanty. I would request this panel to come on and say a few words. Can we start with Hemlata? And I know Hemlata will have lots of queries. Go ahead, Hemlata.
Not really, not too many questions. I only have one question actually, which is surprising. I want to ask one question of Dr. Francis. So the question is, I would like
Francis?
Yeah, Dr. Francis. So I would like to ask her to check with the family whether the child is a mouth breather, because most of these symptoms seem to come out mainly due to the mouth breathing. The GERD, this thing, you know, unless you breathe through the nose gets compressed and the mouth also gets shortened or chota ho jata hai. So all these symptoms in mouth, and that in a child, why should a child have GERD? It's usually more in the adults. So the possibility is the child from birth only has been breathing through the mouth. That creates a lot of problems, including the asthma, including the wheezing. I mean, all the symptoms are put together in that one child, poor guy. So just ask this one question to the family, whether the child is a mouth. If so, please close the mouth and tell the child to breathe through the nose. That will make a lot of difference to the health.
Thank you very much, ma'am. Thank you.
Yeah, and I think the rest are just perfect. Fantastic. Thank you.
Dr. Agnihotri? Agnihotri, sir?
I think sir Agnihotri sir nahi hai.
Pooja Mohanty?
So good afternoon. Good afternoon to everybody. It was a very nice session and I enjoyed this convention on electro-homeopathy. I would like to thank to all speakers and all doctors who came today. And I will like to thanks to Huda sir, who invited me for today this convention, and to Giridhar Gopal sir. Thank you very much. I'm very much glad to see you all. Thank you, sir. Thank you for today's.
And then Dr. Bojraj?
Thank you.
I want you to set the stage on fire.
Yeah, thank you, Dr. Giridhar Gopal. It's a wonderful seminar, I can say, the scientific seminar which you have organized. And this, particularly the liver transplant case you have cured, that itself, it is really a fantastic case. And with document, you have presented everything. He himself, Verma himself, is available to say about all those things. And Dr. Sujata's presentation, these two, they stood out in this whole convention, whatever we have done, the scientific way, what they have explained, it is fantastic. So what I want is every month we should meet like this with particular case histories, what we have explained everything. In the thyroid cases also, what we have explained. And Rafiq told about the eczema, and Shanta also told about the GERD. Okay, and Bina has really done a wonderful job by giving that, particularly the person about along with allopathy medicine. she has really cured the problem. The edema case, we are not stopping any allopathy screening or taking medicine and all. The electro-homeopathy works at the root. You have really given a fantastic feeling to the people who have seen. It started with 25, 30. It reached around, say, 85, 90 people are still, you know, on the panel and they are watching me. It gives us the confidence. Electro-homeopathy has worked like miracle in many cases. It has to be documented. And as Uda pointed out, it is going to be approved by the central government shortly as a mode of therapy. And as on now, we can learn and practice without any problem from the legal side. That's what I want to express to all the people who are attending. Let us learn it properly and practice it along with other therapies. And we will involve even the allopathy system, main system, let us involve them. Now we are trying to give the palliative cure, but my main request is we should go for the preventive healthcare. This has got particularly the scope for preventing the disease rather than curing the disease. So that is why I'm very much interested in getting this publicized such a way so that people learn and prevent their problems rather than curing the problem. Even the heart attack case, she explained, now he is preventing the problem. Other than going to them and getting that bypass surgery done, okay, fine. But if you can prevent it by doing this way, it will give us wonderful opportunity to lead the world. That's what I am telling. This is not an ordinary thing what we have done today. The last convention was good. This convention is very good. We want the next convention should be very excellent. And you must come together with only a brief 5 slides. 5 slides you have to explain what is their problem, what is the present condition after taking these medications, how they have improved, like what you have presented. 5 to 6 slides. If every one of you who learn come to this forum, explain that, will go all over the world. Now people are attending from all over the world, not necessarily in India. India, we are connected like this. Let it go to all over the world and let them follow this simple medication, whatever this thing that it's not medicine. According to me, it is something as a supplement which goes inside the tissue and cures the problem. So I was inspired by our Dr. Yamlata, the Colonel, okay, who has done a wonderful job, and also Dr. Veena. They have motivated me to learn this. I am joining this course. Okay, as an acupuncturist, I have done enough for the last 25, 30 years. And my acupressure has cured my eyesight. I'm 73-year-old. I'm not wearing specs, reading nicely. Earlier, I was not able to read. Now with this simple exercise, I'm able to prevent it. I'm trying to give to the other people, whether old people like us, above 70, we know, at least if we can prevent little bit in the old age, it will be wonderful for us. So I compliment Giridhar Gopal and Dr. Veena and Dr. Renal Huda for organizing this in such an enthusiasm, and they have already reached, but for some minor this thing, you know, the audio is not playing and all, it's secondary. Primary is, by taking these medications as a preventive healthcare as well as curative healthcare, we can avoid many things in our life, and many problems can be cured. Allopathy is there to support us absolutely. As doctor told, allopathy for diagnostic, it is very much required. What is happening inside, only Dr. Sujata can tell. Whereas how it is solved, you will be able to find out later. The person's feeling only will tell they have done a wonderful job for themselves with this medication. With these concluding remarks, I compliment Dr. Huda for organizing such a wonderful convention today. And I request him to have this every month on a particular day, Saturday or Sunday at 11 to 1 we'll be having. And I request all those people who are practicing, please come with some 5 to 6 page presentation so that Dr. Giridhar Gopal can take over and make sure 10 presentation every month we'll organize. And this time we have not given chance for other people to ask questions. Next time I request Gopal, give at least 1 minute for asking questions at that particular time after completing the presentation. That is one improvement we want to make it. So I congratulations to all the people who attended this. Thank you very much for giving me the opportunity. And we are going in a big way for the next session. Maybe 100, more than 100 people should attend in our next session. And I hope Dr. Giridhar Gopal will take the action on that. Thank you very much.
इस ग्रुप में सभी लोगों को गुजारिश है कि वो जो एक ऑनलाइन फॉर्म है वो फिल करके भेजें. I request everybody to fill up the online form and put it up. And not this, we will be sharing a lot of technical information. I reiterate, technical information. I am not worried which kind of medicine you're using, which manufacturer's medicine you're using, whom you learned from, nothing. Every day in the morning between 8 o'clock and 9 o'clock, Monday to Thursday, we run a practitioner support program. You can be from anywhere in the world. If you're an electro-homeopathy practitioner and you have the dilution kit in front of you available, we can help you overcome most critical cases. रोज सुबह 8 बजे से 9 बजे तक अब एक प्रोग्राम रखे हुए हैं जो फ्री है, फ्री एडवाइस एंड सपोर्ट सारे इलेक्ट्रो-होम्योपैथी प्रैक्टिशनर्स ऑल ओवर इंडिया के लिए जो अपने पेशेंट को ले आ सकते हैं और उनको सपोर्ट सिस्टम हम रहेंगे. कई सारे स्पेशलिस्ट ऐसे ऑनलाइन आ जाएंगे और आपको सपोर्ट करेंगे. Thank you very much. Dr. Huda, can you please take over?
Thank you.
Thank you, sir.
Before you speak, request Dr. Nena to mute, please. Because there is a lot of background noise. Can you please go to answer?
Dr. Neena Gayatri.
Oh, thank you. And especially thanks to Dr. Bhojraj for giving this idea. And then thanks to Dr. Giridhar Gopal and Dr. Beena for organizing such a organizing and managing such a events, because this time my schedule was very busy and my support for this session was very less, and both of them handle all the things and check all the presentations, and especially thanks to our doctors who came forward and delivered their presentations, like Dr. Sujata, Dr. Shanta Francis, Dr. Bushra, Dr. Beena, Rini, and Dr. Devasena, Dr. Sheikh. So I'm very thanks, but not only thanks, but I feel very proud that being a president of Electro-Homeopathy Research Foundation, I want to come forward to all the electro-homeopathic doctors come forward and show your things in a documented and appropriate manners. Okay, we are doing a lot of work. Our doctors are doing a good job, good treating some like Pavan, sorry, what's the name of Dr. Giridhar Gopal patient, liver patient Puneet. Okay, so not only Dr. Giridhar Gopal, lots of our electro-empathic doctors are doing this job, but they are not showing the things. So we are creating this type of platform. On that platform, you can come and you can show your things, and slowly we will collect the data, and this data will be very useful for the recognition and for all the things. So finally, I am very thankful to all of you, and कुछ थोड़ा सा हिंदी में बोलने भी जरूरी है, बिकॉज बहुत सारे हमारे जो दूसरे साथी हैं वो हिंदी को इंग्लिश को लेकर के उतना ज्यादा कंफर्टेबल नहीं है. तो साथियों, जैसे कि मैं इलेक्ट्रो-होम्योपैथी रिसर्च फाउंडेशन का प्रेसिडेंट होने के नाते एक पूरा इंडिया लेवल पे इलेक्ट्रो-होम्योपैथी को प्रमोट करने की एक जिम्मेदारी है। तो हम लोगों ने अभी आने वाले जो अगले प्रेजेंटेशंस होंगे उसके अंदर हम हिंदी के प्रेजेंटेशंस भी जो है वो इंक्लूड करेंगे। और आप लोग बहुत अच्छे अपने अपने लेवल के ऊपर काम कर रहे हैं और बहुत सारे पेशेंट्स को आप लोग ठीक कर रहे हैं। लेकिन फॉर एग्जांपल ये कभी कभी जैसे कि जब ये जो सिंगर के शो चल रहे हैं, अभी मैं बहुत ज्यादा अवेयर नहीं हूँ, बहुत ज्यादा टीवी वगैरह नहीं देखता हूँ, बट जो ये सिंगिंग के जो शो चल रहे हैं उससे पहले जब ये शो नहीं चला करते थे तो बहुत सारे सिंगर्स ऐसे थे कि जिनके अंदर जो काबिलियत थी वो उस अपनी काबिलियत को बाहर नहीं लेकर के आ पाते थे। जो ऐसे लोग थे जिनके पास कुछ जरिया थे वहां तक पहुंचने के, तो वो लोग लिमिटेड लोग ही वहां तक पहुंच पाते थे। लेकिन वो जो सबसे बेस्ट सिंगर हुआ करता था उस टाइम पर, इसका मतलब ये नहीं था कि वो सबसे ज्यादा बेस्ट है, बल्कि इसका मतलब सिर्फ ये था कि बाकी लोगों को चांस नहीं मिल पाया था। अभी जब से ये सिंगिंग के शो चालू हुए, दूसरे लोगों को भी चांस मिलना स्टार्ट हुआ। और जो ऐसे लोग जो प्लेटफॉर्म पर पड़े थे या जो कहीं छुपे हुए थे बट उनके पास एक बहुत बड़ा एक कला थी, वो आज उनकी कला बाहर आई है। तो हम लोग भी एक ऐसा ये प्लेटफॉर्म खड़ा कर रहे हैं जिस प्लेटफॉर्म के ऊपर हम लोग, जैसा कि डॉक्टर भोजराज जी ने एडवाइस किया है, तो डॉक्टर भोजराज जी की एडवाइस के अकॉर्डिंग हम लोग मंथली और 2 मंथ में एक इस टाइप का प्रोग्राम वो हम लोग करेंगे। और सारे लोगों को इसकी जो है वो अपॉर्चुनिटी दी जाएगी। और अभी चूंकि ये फर्स्ट ऑनलाइन प्रेजेंट था हम लोगों का, तो आप लोगों को आइडिया भी थोड़ा हुआ होगा किस टाइप से प्रेजेंटेशंस को देने हैं। और एक दूसरे को प्रेजेंटेशन को देने से ये भी समझ आएगा कि मेरे प्रेजेंटेशन में क्या कमी रह गई थी, आगे मुझे किस टाइप की प्रेजेंटेशन देने हैं। और हम लोग इसके लिए एक ऐसी टीम भी रखेंगे जो एक आपको हेल्प भी कर सकती है कि अपना प्रेजेंटेशन को कैसे बनाना है। और धीरे धीरे करके सारे लोग जो है वो प्रेजेंटेशन बनाने सीख जाएंगे। सब लोगों को अपना डाइस पे आकर के अपनी बात को कहने का मौका मिलेगा। आप लोगों को एक अपने अंदर एक अच्छा प्राउड फील होगा। और फिर हम ये सारी केस स्टडीज को एक साथ कंपाइल भी कर सकते हैं, जो कि हमारे जो दूसरे जूनियर डॉक्टर्स हैं उनके काम आएगी। तो आज से हम लोग जो इलेक्ट्रो-होम्योपैथी रिसर्च फाउंडेशन इस चीज को डिक्लेयर करते हैं कि हम लोग इसको मंथली बेस पर या 2 मंथ के ऊपर जो है वो इस टाइप के प्रोग्राम्स को ऑर्गेनाइज करेंगे। और ज्यादा से ज्यादा अपने इलेक्ट्रो-होम्योपैथी की जो प्रैक्टिशनर्स हैं, जो हमारे छुपी हुई और दबी हुई जो आप लोगों के अंदर एक कला है, उसको हम उभार करके बाहर लेकर के आएंगे। और उससे सभी लोगों को अपनी चीजों को निकलने में चीजों को बाहर निकालने में फायदा होगा। तो फाइनली thanks to all of you, and I hand over the stage to Dr. Giridhar Gopal. Giridhar Gopal sir, unmute please.
Yeah. Wonderful. Now, I request anybody and everybody to
सर आपका वॉइस नहीं आ रहा है।
अच्छा,
You are muted.
सभी लोगों को स्टेज ओपन है। एक 5 मिनट हम अलाउ करते हैं सभी को अपनी राय पेश करने की।
Sir, I would like to say something. I'm Dr. Neena Gayatri, and we run the World Storytelling Championship. Today was an eye-opener for me. I thank Boja Jana for calling me, and today was an eye-opener for me because we have been in management and, all that. We just tend to forget and not even know all this. So, I just saw another area where we in storytelling could, could work with all of you, such stalwarts, because we are taking storytelling on environment, on health issues, and so many things. But this also could be told through stories. We have amazing storytellers, and we could, we could work together and create something wherein at schools, we are connected to 7 countries all over the world.
Absolutely, absolutely.
Wonderful, Nina, for your nice suggestion. I think you can take it anywhere in the world. Okay, absolutely no problem. These are all real case histories. What they have told today, there are real case histories. When Giridhar Gopal has shown the person also, he is online already. Verma is online. and you can take it to any place. This is what, God has given us a tool today to give this technology to anywhere in this world. All human beings can be given this technology, and we are very happy that you could attend today. And please take any story, whatever they told directly, you connect to them. Take it to any place you want. You can call them also and talk to them directly. Thank you very much, Nina, for attending.
Thank you for inviting me to such and creating a space for this kind of sharing. Thank you so much.
Anybody else would like to give some suggestion? Because in fact, we want to start this class as early as possible by Dr. Huda, and we'll be attending all those who have already done 5-element theory under the advanced acupuncture course, any course. They will get wonderful, easy to follow all these things. So please make sure next class, many people attend this and learn properly how to utilize our 5-element theory for curing, not only with acupuncture, but with this electro-homeopathy medicine also. We don't call it medicine, but still, it is something which goes inside. We have to call it as medicine. Any suggestion, please give.
Yes, sir. I would like to suggest that this video should be posted on YouTube so that many people will know about this program.
We will do that. We will do that. It's 2 hours program. Yeah, I think
Definitely we
the
will post
organizers.
it on YouTube, and
Dr. Nina, please.
we will share the YouTube link in all the groups. Okay, so you can go there and download it.
I request I think Dr. Beena to request all the people to come on video, take a photograph, and just we will put it in our newsletter also. If you give complete, all of you can come on your video. There are 90, around 75 people are there right now. You can take a photograph and send it to us. Okay. We will advertise as much as possible, so people are getting cured and they have to learn and practice. And those who are practicing, please do it for the satisfaction of the God has given you an opportunity to cure someone. That itself is a great achievement. We are not curing anybody else. They are getting cured themselves. From bedridden patient has started working within 6 months. That itself is a great achievement. We saw with our own hand, with our own eyes, and we have seen such people. So we have to give this to the world. Okay, there's healing. All these things have to be shared very wide. Okay. Thank you. I think any other suggestion, please write to us. Giridhar Gopal is there to lead us, and he will take the electro-homeopathy to the greater heights in next 1 year. Thank you.
Also
One
post
more
the
point I would like to say,
morning group link.
7-8 साल पहले, 7-8 years back, the medicine kit I had was a whole almari. D1D, 2D, 3D, 4D, 5D, 6D, 10D, 100D, 1000, all kinds of things. Today, I move round the world, believe me, round the world with a small kit like this.
Sir, I am Srinivas Tobut.
Sorry to interrupt you.
That's all I carry.
You have any suggestion, please tell Srinivasra.
Again, one more thing, rectified spirit we don't use, we use water-based, and that has changed the whole perspective of electro-homeopathy.
I think the kind of presentations is really excellent today, what I have seen. And quick sharing is for 80-year-old lady, we have given electro-homeopathy eye liquid. She was not able to see more than 1 foot, and it is a blurred image, and ghost images what used to see earlier days. Within 2 months of giving electro-homeopathy, her vision started improving, and now she started seeing the colors also, and TV also, and she is able to see her own son within the distance of 4 to 5 feet. Clearly she is able to see. Earlier it was not possible. So that is the power of electro-homeopathy. I think I have been using for 3 years, last 3 years.
Wonderful. Anyway, now we are working on this thing only improvement with
With
acupressure.
acupressure also, I have done very good results. I have got with acupressure.
Electro-homeopathy combination, it's really good. Okay, that's what we are trying to motivate people to trying, there is no harm, especially, if you try this, if it works, fine. There are 90%, I am confident it will. The 10%, I don't know, maybe God's great blessings are to be there. God's grace is there, only will get cured. Okay.
Those who can do, I am giving acupressure, otherwise I am giving electro-homeopathy.
No problem.
In fact, earlier I used to cure cancer patients using neuro-linguistic programming, surgery of the mind by talking to them. Then I found that things come back again after some time. We needed to do something. Then I learned acupuncture, acupressure, sojog, various things, till I landed on cellular level secondary metabolism correction using electro-homeopathy and spagyric essences. This was the game changer. Now, along with NLP, acupuncture at times, and electro-homeopathy, results are amazing. Of course, I principally try and use only electro-homeopathy, and I've been very successful at that. Yes, Dr. Bushra, I can see you saying something.
Anybody else? How much time you have? Another 1 or 2 minutes? I think we'll.
Yes.
Good afternoon, sir. I'm Babuji speaking from Ranipet, Tamil Nadu.
Yeah, Babuji.
Yes, good morning. Very nice to meet you, sir. Very happy to meet you.
Please.
I am a traditional Ayurvedic practitioner, magnetotherapy, electro-homeopathy, and acupuncture your way. Because when I started acupuncture, I have treated one patient for umbilical hernia, for which I, first of all, I have one doubt. Within 4 minutes or 1 minute, with 4 needle, whether it is possible to recover from the patient. Afterwards, after practice that, I wondered within 4 or 5 sittings, the patient felt very much relief, because the umbilical hernia is a structural problem. Afterwards, when I practice, I included that EH medicine, giving water tea and earth tea. It is very having allied with our acupuncture treatment and EH treatment. Recovery is very, very fast. I wondered very much, because both.
That's why we are combining acupuncture with the electro-homeopathy.
Yes, moreover, our theory also in 5-element based. Then EH also in a unique manner, he introduced the 5-element manner. Both are very same line. So it is very much interesting to practice now. Moreover, in that one infertility case also, and the proliferation phase and the follicular phase, the in will be low.
Dr. Umashankar Raj, please.
Yeah.
Hello.
Yeah.
Good morning, sir. I'm Umashankar from Hyderabad. Sir, personally, I request, because every time I'm attending, but I'm not able to catch it. I've served in Indian Air Force as a diagnostic and physiotherapy. And after that, I learned acupuncture, acupressure, and now I got registered from Maharashtra. Electro-homeopathy also, I'm keep on attending, but so far I not got the opportunity to go from the beginning. I'm not able to catch. Always that already practitioners are giving. It's my personal request to kindly start from basic, some course, so that new learners can join and we can do even wide spreading of the subject.
Yes,
yeah.
we are starting only from zero level.
Yes, sir.
Basic.
When will be the
Absolute
course?
basic.
Next course is from 0 level. We are all considered, though we are
Yes, sir.
acupuncturists,
Yes, sir.
element theory we have only given to this India, but we want to learn from the 0 level.
0, sir.
We have asked Rayano Luda to go from the 0 level. Next course will start with 0. All of us will attend. Okay.
Yes, sir. Because lot many people are with me. We can together take the subject and.
Please give
yes,
your
sir.
name and address, whatever it is, to Giridhar
Yes.
Gopal. We will
Yes,
organize
sir.
within
Yes,
a
sir.
month. Huda's convenience. We will organize.
Yes, sir.
Physical meeting also we can have with Huda for 1 or 2 days in Bangalore. Bangalore
Yes,
will
sir.
be our main place where we will be conducting the courses, and the online courses also will start now. No
Yes, sir.
problem.
Thank you, sir.
I request everybody to fill up the online form and send it so we can keep you posted with information.
Sir, whether it will be forwarded in WhatsApp group, sir?
Yes.
Yes.
Dr. Nanda?
Sir, one more,
Yes,
one more
Nanda.
request.
You have to unmute Nanda Kumar. Unmute.
I'm also having the same question to Dr. We need a basic course to start. Already he recommended, already by the time the classes started, so I'm waiting.
We are going to start shortly, depending on Huda's convenience, and Giridhar
In
Gopal
fact,
is going to.
earlier we used to have a 5-element course basics independently with a set of 10 patent medicines, and then we had an advanced course where you could go right up to using dilutions. Now, with acupuncturists who know the 5-element theory, we are going to the next stage, the next level, where I'm not going to spend much time on the 5-element theory. I'm going to bring in meridianology and basic elements of electro-homeopathy, and then advanced electro-homeopathy, all in a 20 or 25 session that is spread over 2 months or 3 months, and really take this to the next level.
That should be very nice.
Wonderful. A lot of people are interested in joining. Let us start from the 0 level and give an understanding, because 0 level, when you start, even advanced acupuncturist also may be joining. Doesn't matter. So let us start from the 0 level. We'll make sure they don't know anything about electro-homeopathy or acupuncture. We'll start with that and we'll give. If they are giving more on electro-homeopathy, fine. Okay. Otherwise, the acupuncture also, the theory we will cover. Absolutely no problem. Wherever it is required, the 5-element theory will cover in detail. In depth we can cover, so that people will understand the theory behind all these things, and then start giving the medicines, whatever it is. Okay, that will be ideal for us. Yes, Dr. Huda suggested, okay, the Hindi session also can continue separately, but here I want it to be in the English session as much as possible. Then the translation also can be done along with that.
Already in the classes, we are continuing the absolute session. Separate Hindi session is separate and English session is separate.
For the Bangaloreans, you make it only English session, so that people will understand.
Already earlier we are doing the same thing. Okay, Hindi session is 2 to 4 noon, and my English session time is 8 to 10. So already we are doing same.
Wonderful. Okay. Thank you. My request to all these specialists, okay, whatever electro-homeopathy specialists we call, kindly record all these things, like our Dr. Sujata, who is given wonderful record of what has happened earlier, what is happening now. Similar, that is what we are going to fight with the government to give the recognition. So we want your records, each cured with this. So make sure whomever you treat, you should have a record in the beginning and record in the recovery. Maybe 1 month, 2 months, 3 months, doesn't matter. Let us have all those things, and then we will start making the scientific reports and discuss among ourselves and put it across to the electro-homeopathy main committee. Okay. Thank you very much. In fact,
Jaswinder, come online.
Yeah, taking our advice and doing this. It's a 2-hour session. Already it is 2 hours, 15 minutes, more than that.
Jaswinder Kaur.
Who else is interested in
Jaswinder Kaur.
Yeah, please come online. Switch on your video.
Jaswinder ji.
Yes, good morning, sir.
Good morning. Yeah, please go ahead.
Good morning, sir.
Yes.
Any suggestion, please tell.
Sir, it's a good session. Sir,
Yeah.
it's a good session. And Mrs. Sujata gave a good session. All practitioners like do this, then government recognition for us.
Okay, nice.
Jaswinder, I would like you to collect all the Hindi speaking belt to come up with the next session. Where the whole Hindi speaking population who are not very conversant in English, उन सब से सबको कनेक्ट करके जो अनमोल लिटिल अनमोल डायमंड्स है उन सबको बाहर निकालो.
Okay, sir.
Right.
Okay. The 0 level course we will start as early as possible. Somebody has given. Let us see.
Yes.
Thank you, Mrs. Francis. Okay, for your nice presentation, and he is with you. Your husband is with you. Yeah. Very nice. Meet all you people. That is what like, we are a live examples. We follow certain things. 100% we should follow and stay healthy. Especially
Request everybody to fill up the online form and support us. Thank you.
So now we'll close with the thanks to Dr. Beena for the wonderful. You can formally you can say something about this session. Beena.
Dr. Beena, the closing session.
Closing session is yours.
बोले कहाँ था? मैं बोले कहाँ था? तो म्यूट कर दिया.
Okay.
Yes, Veena.
You were not able to hear me, sir?
Yeah, able to hear.
You're able to hear now. Okay. So I'm very grateful and thankful, sir, Dr. Bojraj, especially for giving this beautiful idea to come together as a platform and present all the cases. So it's a very good initiative. It will take us forward. And the way electrohomeopathy works is I'm really very happy to be here and treating patients and seeing them happy, getting healed. And also, it is a very good platform to create that kind of awareness about health and disease. And the understanding what we are having now is definitely a much, much better and a different level, because even the medicine has started recognizing these aspects of healing, which happens in the conscious level and the subconscious level. So we are at the right time doing the right things, I think, now. So let us take this forward, and with all of our cooperation and that little extra, as that day Nabid Lakur sir said, we all can definitely take this forward. So thank you very much. Thank you, Dr. Huda and Dr. Jizu sir, all the presenters also for your cooperation. I know all of us were so busy, we somehow made it.
Yeah, please unmute yourself.
Hello.
Yes.
Sir?
Yes.
Thank you very much, everyone. I think we'll bring the curtains down on today. And thank you, really thank you, everybody. Please register your names using the online form. Thank you.
Thank you.
Thank you.
Thank you all.
Thank you. Thank you, Dr. Huda. Thank you, Dr. Giri.
Thank you, sir. Thank
Thank you very
you,
much,
Dr.
sir.
Huda, sir, and Giridhar, sir. Thank you very much, sir.
Very good presentation, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Yeah.